Hello, my people. So, today let's talk about neurological assessments. So, if someone has had a head injury, if someone had a seizure or epilepsy and they had a fall, they hit the head. If someone who is elderly has had a fall, all those stuff that someone has a head injury that makes someone told that they have a head injury. What are you supposed to do as a nurse? So you have to do other vital ops like blood pressure, pulse, temperature, saturations, respirations. So the other thing is neurological ops, which is very important, or neuro ops, or head injury ops. So we use three things mostly, and I put it in abbreviation EVM. EVM, that's a way of remembering. E for eyes, V for verbal. I was about to say vambo. Verbal. And then M is for motor. So E, let's start with E. We start with E. Is this someone, or is this person able to open their eyes spontaneously? So how much do you give? So there is scores in all those three categories I've stated. So when you go to the room or the ward in this case, and you go to the bedside, is this patient able to open their eyes spontaneously when you talk to them? Or do you have to inflict pain? There are those who are maybe unconscious. So there's ways of making this person to respond so that you can give a score. So if this person is opening their eyes spontaneously, that's a score of 5. So if you have to inflict pain, and where do we inflict this pain? So it's called trapezius, just above the shoulders. That's where you press. So we were told, I think this changed. We were told earlier when we were studying, they were saying we can use a sternum, like aggravating pain on the chest, on sternal area, which is not working in Australia anymore because it's not being used anymore because it can cause so many harm, like bruising someone, something like all those sorts of injuries. So verbal, is this person talking to you when you ask where they are? So the main questions you ask this person to make sure whether they are orientated. Do you know where you are? What's your full name and date of birth? What is the day today? What year are we? And then you score according to what they are telling you. So if someone knows where they are, they know their full name and date of birth, so you automatically give a good score. And then sometimes some people do not know all this. They can't answer all the questions at where they are. They can answer where they are and their date of birth, and maybe their hospital number, but sometimes they may not know the dates, which is making sense, because sometimes we don't know the dates. So you don't have to judge harshly that or give a very low score because this person don't know the date. So you have to consider other things. But if they don't know the year, so that's you always depend with the year. If you, like, we are in 2024, and if you ask someone, they tell you we are in 2020, there's something wrong there. All right. So the other one, another thing to check on the orientation part, if you use 7 months backward, you tell someone to tell you, or you tell the patient in this case to tell you 7 months from December backwards. December, I mean, it's very hard, and some people can even tell you without even thinking about it. So that's a tick. If they score all of them right, that's a 2. If they don't score, if they fail a few, just one mistake, I mean, yeah, so you score according to how they are. In this case, you have a form. It's called a NeuroOps form, where you can see how much you're supposed to give this person. It's not coming from your head. Another thing is motors. So M, we said we started with EVM. So M, motors, you tell this person, it's about motor, it's about peripheral muscles. So you tell them to squeeze the limbs. It's all about the limbs as well, upper limbs and lower limbs. So you tell them to squeeze your hands. So you like greet them to squeeze my hands. You can also go at the foot of the bed, tell them to push you. You put your hands just on their foot. Tell them, can you push me the best with all your energy, the best way you can. And then from there you'll be able to know whether this person has motor sensitivity. Or also you can also tell them on the upper limbs, you can also tell them to lift their arms, the right and left arm. And then from there you'll be able to give your score. And if it has happened today, if someone has those maybe the fall today or the accident today, whatever it was, whether it was MVA, that is motor vehicle accident, home mostly we call it RTA, road traffic accident, you have to do those observations every 4 hours. So just the vital signs and the NeuroOps every 4 hours to just make sure this person is okay and they're not bleeding, all those sorts of assessments. Okay guys, bye. Thank you so much for listening to me.